AI Nexus community. Google just released an update this week on their latest groundbreaking AI product. Its capabilities do not only break barriers on what we've seen thus far in the AI world, but it's impacting the healthcare sector and could literally be life-saving. We've already seen the release of Google's MedPalm 1 back in 2021, but Google announced this week they are currently sending their next version, MedPalm 2, into testing phase. What's insane about this announcement is this is not just a theoretical idea, but is actually being tested at the Mayo Clinic as we speak. In this video, we'll break down what we can expect from Google MedPalm 2, the features, and most importantly, the use cases, and what you can expect to see the next time you visit the doctor, sooner than you think. Before we dive in, the AI Nexus brings you the latest breakthroughs in AI as soon as they are released. Subscribe to our channel so you don't miss a single update. Now, let's meet Google's MedPalm 2. What is MedPalm 2? Well, MedPalm 2 is the successor to MedPalm, a groundbreaking LLM released in 2021. This advanced model has been fine-tuned specifically for medical applications, making it a powerful tool for healthcare professionals. Trained on an extensive dataset encompassing clinical notes, medical research papers, and drug information, MedPalm 2 possesses the ability to generate accurate and informative text that surpasses other LLMs. Okay, I get it, another groundbreaking LLM from Google, but what sets this apart from the others is its three main real-life applications. First, its ability to diagnose. MedPalm 2 aids doctors in making more accurate diagnoses by generating hypotheses about the potential causes of a patient's symptoms. It also excels in identifying patterns within medical data that may indicate specific diseases. Second, its ability to recommend treatment. After the diagnosis, MedPalm 2 then opines on the treatment. MedPalm 2 assists doctors in developing more effective treatment plans. By considering potential drug interactions and adverse effects, it provides tailored treatment options for individual patients. And the third real-life application is research. MedPalm 2 plays a crucial role in medical research. It can generate hypotheses about disease mechanisms and identify new drug targets. Additionally, it can summarize and interpret complex medical research papers, accelerating the discovery process. These three real-world applications are not an AI improvement to a video game or some productivity hack. This AI breakthrough could single-handedly accelerate the progress of modern medicine in our lifetime. The ability for MedPalm 2 to immediately disrupt an entire industry for the better is a much larger possibility than most AI developments. MedPalm 2 has the potential to revolutionize healthcare delivery, and here's why. First, its accuracy and informativeness. MedPalm 2 surpasses other LLMs in generating accurate and highly informative text, making it a valuable tool for healthcare professionals. Secondly, its versatility. MedPalm 2 covers a wide range of medical tasks, including diagnosis, treatment, and research, making it a versatile and comprehensive solution. And third, its transformative impact. As MedPalm 2 continues to evolve, it holds the potential to revolutionize healthcare by aiding doctors in making accurate diagnoses, developing effective treatments, and conducting efficient research. Now, we've told you all the great things MedPalm 2 could potentially do for the healthcare industry, but we need to make sure we cover all sides here. When it comes to implementing an AI tool that is making life and death decisions, naturally there are going to be limitations. Here are some of the limitations we are seeing. To start, it's only in the development stage. While the potential is off the charts, this LLM is still going to take significant training before it's matching the accuracy of human doctors. Second, it's inherently going to contain biases, just like any other LLM release we've seen thus far. MedPalm 2 may reflect biases depending on the data it is trained on. Careful consideration of biases is necessary when utilizing the model. And third, and most likely the biggest hurdle, will be regulatory considerations. The future regulation of MedPalm 2 is still unclear, raising questions about how it will be governed and integrated into clinical settings. Governments are still trying to wrap their heads around the AI revolution and what checks and balances they need in place. There is no doubt MedPalm 2 is going to be groundbreaking. In the very near future, it will not be uncommon to walk into a doctor's office and to first communicate with an AI robot powered by MedPalm 2 before seeing a real doctor. In fact, in some cases, a MedPalm 2 powered robot may be the only doctor you see. Just this week, the WSJ reported an internal email was leaked by Google, saying the largest use case for MedPalm 2 will be in countries where access to medical care is scarce. Sure, privacy of medical records will be of concern, but the good MedPalm 2 will have on the entire healthcare industry will outshine any concerns. And finally, the medical profession is not the only industry on the verge of disruption from AI. Have you heard about the latest AI breakthrough happening in the toy industry? You have to see this video.